Welcome to the 7th annual meeting of Northwest Precedent. This will be the 7th and final annual meeting of Northwest Precedent since we were given a grant, a 7-year grant, to create and operate a regional network. That grant is ending, and the next phase of practice-based research will be a national network, which you're going to hear more about in a few minutes and tomorrow. I'm Tim DeRouen from the University of Washington. I'm the co-director of the network chair component of Northwest Precedent. I want to welcome everyone to what should be an exciting and interesting meeting. This has been an ongoing project for 7 years. Like I said, we've conducted several studies, 15 as a matter of fact, and we're presenting results from most of those today. Before I get into some of the details, let me just make a few announcements as we get started. For those of us who are presenting, before your presentation, the speakers, please check in the back of the room and get mic'd up so that we don't have to delay getting you ready for your presentation. A couple of announcements also. Raquel Capote will be presenting the session that's entitled Give Me a Break, Things We Need to Learn About Part-Time Retainer Wear this afternoon during the orthodontist breakout session instead of Greg King as was originally indicated. I'd also like to introduce someone who's been sort of a peripheral member of this network, doing a special job for us, Dr. Kim Ruana. Where's Kim? I know she's here. Kim, would you stand up, let everybody know right in front? Kim is a member of our protocol review committee for this network. She was actually going to be a member of the network, and then we had to have a protocol committee to review all the protocols, and we needed a general practitioner member type to be a component of that. And she either volunteered or I twisted her arm and served in that role for the entire time of Northwest Precedent. And then she has since relocated to Houston, and we were able to invite her to come back to participate in the meeting to see some of the fruits of the protocols that she and the rest of her committee reviewed for us, and in many cases improved for us during that review. So thank you for all your effort, Kim. The breaks and the posters will be in the registration area, same as the breakfast was, and hopefully you noticed the posters. They're not going to change, they will be up the whole time, but when we have break sessions, I encourage you to wander around to look at the posters, especially ones related to studies that you participated in. Those will stay up, and we will give presentations on several of these, but we will have people who worked on those studies available to talk about them during the breaks, so please take advantage of that. Okay, I want to give a brief overview of Northwest Precedent. You know, when we started this, when we responded to an RFP that NIDCR put out, a request for proposal, the stipulation in the RFP was that to create a network, the network had to have at least 100 members, and they had to they were supposed to complete 16 to 22 studies during the 7 years of the network. Well, this is our report card for members. The last count is active members. We have 358. Now, active means you're steadily in contact with us. You were either fully trained and enrolling patients from your offices into clinical studies, or you were participating in surveys of dentists, but you were communicating with us on a regular basis and participating. So there are 358 total. of that number, there were 217 who were what we call fully trained. By fully trained, we mean people who went through our one-day training session, either in person or by looking at the DVDs, the videos, and having a session with us. So 217 of you went through that amount of training and participated in studies. Of that 217, 44 are orthodontists. We have kind of a sub-network of orthodontists that's been very active. 3 studies have been completed among that group, and you're going to see some of that today. We have 20 members who work in community clinics, and that's kind of a special situation, and we worked hard at getting dentists who work in that kind of situation, and we're pleased to have that many of them. And we have 7 pediatric dentists. Besides this 358, we also have 169 people who we call friends of Precedent. They're people who may be in different geographical areas, some of them outside the country, some of them are interested but not willing to fully participate, but want to hear from us. So there are 169 of those who also keep up with what we're doing. So we reached our goal of 100 a long time ago, and we've exceeded that, and we've had a very active membership. This is the geographical distribution of the active members, and you can see that we cover mostly the Pacific Northwest, which includes Oregon, Washington, Montana, Idaho, and Utah, but also some in other states as well. As we expanded for various reasons, we had people join who were special cases that we admitted in some of the other states as well. This is a list of studies, and I'm going to just briefly mention them. You'll hear more about them during the day. But just to briefly go over them, we started out, study 1 was an oral disease indicator survey, which was a survey of a random sample of 20 patients in each of the first 100 members of the network. That gave us a picture of the population, the patient population we were working with. We did a study on salivary markers and caries risk assessment, which is still ongoing and winding up with 2-year follow-up. We did a study, a case control study of osteonecrosis of the jaws, a trans-PBRN study. This symbol of condor means it's a study that was done over the 3 networks. We did a study on computer-assisted relaxation learning, a behavioral study. We did one on assessing the outcomes of cracked teeth, and we're just presenting some of that for the first time now. Study 6 is a randomized clinical trial on MTA and calcium hydroxide, a randomized trial for use of that in direct pulp cap treatment. We did a study on treatment of dentin hypersensitivity in dental practices. That's a survey of dentists of what they use for treating dentin hypersensitivity. We did another survey of hypersensitivity prevalence in patients in a random sample of patients in multiple practices. A study of third molar extraction, indication and outcomes of it, which is a very popular topic. We did a study, a study of the impact of dental practice-based research. It was a Condor study, and we'll hear about that in a little later this morning. A study of temporary anchorage devices in orthodontics. A study of overbite retention strategies in orthodontics. A study looking at advancing primary care management for TMJD pain, which was another collaboration with the other networks. A study of remineralization treatment of white spot lesions in orthodontics, plus some others. And then we did a study of the of the dental needs of special care patients. This particular survey that was done is of significance because it was of particular interest to some of our members, and one in particular, who, when we did the survey to look at attitudes and practices of dentists in treating special care patients, special needs patients, the preliminary results of that was taken by one of our members, Patrick Haggerty. And where's Patrick? I know I saw him here. Here he is in the back. He took the results of that to a woman he knew who had some interest in doing something in memory of her husband that was significant because of his interest in general practice residency programs and a need for such programs and what they provided in training for treating patients with special needs. He convinced her to give the Oregon Health and Sciences University a gift of $1 million to restart their GPR program. So congratulations, Patrick, on accomplishing that. So those are the studies that we carried out. We were tasked with doing 16 to 22. These are 15. We actually had another one that we were ready to embark on, a genetic study related to the caries risk assessment, and for various kinds of reasons, NIDCR decided they did not want us to embark on that in this setting. So we would have had 16 if we had been allowed to carry that one out. So my argument is we've done what we said we would do, and I think you will see today that we've done it well, and you should be proud of your participation in doing that. So at this point, what I'm going to do is turn the podium over to Dr. Don DiNucci. Dr. DiNucci, as most of you know if you've been to one of these meetings, is our project director at NIDCR. He is responsible for working with the networks and with the new national network, and he's going to tell you a little bit about what the future is in networks from NIDCR's perspective. Don?